Very good. And ladies, you see that both Dr. Daly and myself, we have had our mammogram this year already. Mine lasted for about 10 minutes. Dr. Daly's lasted for 45 minutes. So we left the imaging center okay, no pain at all. So, Dr. Daly, what will happen to those ladies who do not get their mammogram done? What would you suggest they do?
Well, the recommendation and the different consensus groups, and the ACOG, which I follow, recommends having your mammogram done at 40 and every year, or 1 to 2 years, depending. There can be a discussion between the patient and the doctor about how frequent you want it done. If you haven't had it done by 50, you certainly need to get one done at 50. There are other groups that recommend starting at 50 and doing every 2 years. American Cancer Society goes along with the 40, or at least by 45, and then checking every year to 2. And then there's another consensus group that agrees with those. The United States Preventive Task Force is actually the one that's recommending 50 and above. And again, some of this is because of fears about false positives and anxiety that patients may have, because if you tell them that there's something that it may not necessarily be a bad thing, but if they have to have follow-up studies, then they get very anxious, and sometimes they don't want to follow up. So, but it's very important.
In my office, I start recommending mammogram at age 40 and yearly thereafter.
That's what I do.
Right. And what are some of the signs or symptoms of breast cancer if someone refuses to get a mammogram done? What should they look out for? Any changes in the breast?
Well, it's important. I mean, the American Cancer Society and other groups have been less supportive of breast self-exams because they said it just leads to anxiety, it can have a lot of false positives, end up having more biopsies than you need to have done. However, it's important to have breast awareness.
Right.
Everyone needs to know what their breast normally feels like.
Agree.
So that if there's any change, any abnormality, you can say, this wasn't here last month, let me check it again. And if it persists, then it's important to follow that up. Many breast cancers have been diagnosed by the patient as opposed to mammogram, but the self-exam is actually not as sensitive. If there's something that's less than 2 millimeters, you may not feel it.
Right.
So it's important to have the screening. Most people who come in who have diagnosed with breast cancer have no symptoms. They don't feel anything. Their breast may feel lumpy. Again, that goes back to breast awareness, because if you don't know what your breast normally feels like, if there's a change, you may not be aware that there's a change. But there are other signs that can occur. There's one type of breast cancer called inflammatory breast cancer, where a lot of times you come in, all of a sudden you develop redness. It may be red, it may be kind of hard, maybe kind of painful. People need to be aware if anything like that happens. It could be an insect bite, it could be something else more benign, but it's important to follow that up. But redness, discharge from the nipples, especially if it's one nipple,
right.
Bloody discharge are ominous signs.
Nipple retraction?
Nipple retraction, or there's going to be an orange peel appearance, peau d'orange. Those things are definitely...
What is orange peel appearance? I think the common woman doesn't know what that is.
Yeah, it's looking at the orange peel, there's kind of some dimpling that you can see there, indentation. And that, usually when you have that, the cancer has progressed further. But lumps in the breast, there are lumps that are benign, again, going back to breast awareness, but there are some things that feel different. If it's not symmetrical and you check on one side and you don't feel the same thing on the other side, and it's prominent, nodular, hard, you can't move it, those are definitely things that you need to bring to attention of your doctor, or,
Correct.
go get screening.
Correct. And ladies who have not been screened for a while, who probably have persistent back pain, should see their physician. I just had a friend who was diagnosed with breast cancer stage 4 because she was not getting her yearly mammogram, and she presented with back pain. Then when she was seen by the doctor, the cancer was already in the bone. Okay. So ladies, do not hesitate to see your doctors. And if you do not have health insurance, then during the month of October, many institutions and facilities offer the mammogram for a decreased cost. I know here in South Texas, the various hospitals like Doctors Hospital Renaissance, even the other hospitals
Yes,
around.
and some freestanding
And
centers.
freestanding imaging centers will offer a discounted rate for you to get your mammogram. So ladies, you do not have any excuse this year not to get your mammogram done.
And let me also speak to the group. There are some women who will feel a lump and they know it's different, but they, because of fear of finding out what it is, decide to wait. And then 1 year goes by, second, third year goes by, the lump is still there and it's growing. And then at that point, they may decide to go get it checked out. Just don't let fear cripple you, please. You need to go and get it checked. If there's something that feels strange, you're not sure what it is, even if it's nothing, it's more important to go get it checked and to get screened than to stay and develop a highly advanced cancer lesion.
Right.
Okay?